Welcome to the deep dive. Today we're looking at something really fundamental. Our sources are making this claim that honestly sounds pretty radical at first. They're saying that elimination, going to the bathroom, should be just as simple, just as easy as eating, because they're basically two ends of the exact same tube, the same process. So when things go wrong, like with hemorrhoids, they argue you can't just look at the end of the line. You have to go back, right back to the start, back to the mouth.
That's exactly it. It's a compelling argument. Before we just accept discomfort or pain, we need to understand what hemorrhoids even are. Fundamentally, they're just swollen veins around the anus. They can be internal or external. And, these veins are a normal part of our anatomy. They're supposed to be there. They only become a problem, become pathological when our overall health, our whole system kind of fails them. It's not just a local issue.
Okay, so that's our mission for this deep dive. We're going to unpack three big factors that often get missed. Things like hidden problems in your mouth, how your stomach's actually working, and even chronic stress, things you wouldn't normally connect. And then we'll get into two specific natural tools that might help manage things once you're addressing those root causes. Okay, let's unpack this, starting right where everything enters the system, the mouth.
Yeah, the digestive superhighway, as we sometimes call it. The mouth is the absolute key entry point. And the research we've looked at really emphasizes this. The mouth isn't just for chewing. It's constantly sending information signals to the rest of the body. So if your oral health is off, it's like sending distorted messages or even toxic signals downstream, constantly.
And we're not just talking about a little cavity here and there, are we? The sources point to bigger things, like actual mechanical issues, missing teeth, affecting how you chew unevenly. And then there's plaque and tartar buildup, which is basically a low-grade infection running all the time.
Exactly. But the really striking point in these sources concerns old dental work, specifically amalgam fillings, the silver ones, and potentially other types too. The issue is that they often contain heavy metals, things like mercury, aluminum, silver, maybe even lead.
Whoa, okay.
And while they might seem inert, just sitting there, over time, tiny amounts of these metals can leach out. This isn't just a mouth problem. It becomes a systemic burden. The body has to constantly try and process this low level of toxicity.
Hang on, I need to pause you there. We're talking really small amounts, right? For maybe one or two fillings. How does that impact something way down at the other end of the digestive system?
It seems disconnected, I know. But the body really struggles with heavy metals. It doesn't have great mechanisms for just eliminating them easily. So when they're released constantly, even in tiny amounts, it puts a strain on detoxification pathways, especially the liver, and it activates the immune system in a low-grade chronic way. You get the simmering body-wide inflammation, and that inflammation can weaken tissues everywhere, including the lining of your gut, making it more permeable or leaky, and crucially, it can weaken the walls of blood vessels, including those delicate veins in the anal area. You're basically creating the perfect internal storm for things to fail down the line.
Okay, wow. So you've got potential chemical interference from metals, plus maybe mechanical issues from poor chewing. Then you add on top of that the standard modern diet. Lots of processed stuff, sugar, flour, soda, maybe alcohol. The stomach will just get slammed immediately.
Yeah. Immediately overwhelmed, yes. And this brings us to what some call the acid paradox. It's a huge point of confusion for people dealing with heartburn, reflux, or gastritis. You feel that burning, right? So your immediate thought is, I must have too much stomach acid.
Yeah, of course. That's what it feels like.
But very often, the real problem is the complete opposite. It's a lack of strong, sufficient stomach acid.
Wait, how does that work? If I don't have enough acid, why does it burn? That sounds backward.
It does feel counterintuitive, but think of it this way. The acid you do have, even if it's weak, can easily splash back up into the esophagus. Why? Because the little muscular valve at the top of your stomach, the sphincter, isn't getting the signal to close tightly. That valve needs a certain level of acidity, a specific pH, to clamp shut properly. If your acid is too weak, the valve stays kind of loose.
Ah, okay. So the burning isn't too much acid overall. It's weak acid in the wrong place because the door isn't shut properly.
Precisely. So when people take medications like proton pump inhibitors, PPIs, these so-called gastric protectors...
Yeah, they're really common.
They are. But what they do is essentially shut down the stomach's main job. They reduce the acid even further. So now food isn't being properly broken down or sterilized. This undigested mass then moves into the small intestine. and it basically irritates the entire rest of the digestive tract.
And that chaos leads to irritation all the way down, maybe causing that awful cycle of constipation, then diarrhea, things often labeled as IBS, irritable bowel syndrome. The gut bacteria get completely disrupted, and the waste that finally reaches the end, it's often hard, poorly formed, and just abrasive.
Exactly. And the anal canal is incredibly sensitive, packed with nerves and delicate tissues. When this kind of waste has to be forced through day after day, it's the final straw. It's the constant irritant that leads to the swelling, the straining, the pain we call hemorrhoids.
Okay, this is making sense physically. But now, here's where it gets really interesting for me. We shift from the physical stuff in the gut to something less tangible, the nervous system, chronic stress.
Yes, and it's vital here to distinguish between two types of stress. There's acute stress, short-term challenges, like narrowly avoiding a car accident or maybe a tough workout. That kind of stress can actually be good for us. It's called hormetic. It builds resilience. It forces our systems to adapt and get stronger.
Right. But that's not what we're usually dealing with day to day, is it?
No.
Yeah.
The problem is the chronic stuff. The slow burn, the job you dislike, the difficult relationship, lingering grief, or just that constant low-level feeling of being overwhelmed, maybe financial worries.
Yeah, the stuff that just grinds you down.
And here's the kicker. Our body's stress response system, it's ancient. It hasn't really updated its software for, well, millennia. Think about the sympathetic nervous system. That's our fight or flight response. It evolved over millions of years for one main reason. Survival, like running from a predator, a lion, let's say.
Okay, the classic example.
Right, and if a lion is chasing you, what's the last thing your body needs to do?
Stop for a bathroom break.
Exactly. So in that fight or flight mode, the body intentionally paralyzes the elimination process. Digestion and elimination are put on hold. Survival is priority number one. There's no time for anything else.
Wow. Okay, so my nervous system literally cannot tell the difference between a lion about to eat me and my boss yelling, or my overflowing email inbox, or even just worrying about problems that haven't actually happened.
That's the crux of the modern dilemma. That same ancient survival program gets triggered by today's chronic stressors. It keeps us locked in this state of high alert. And a key part of that state is shutting down the gut motility. The intestines literally get paralyzed. Meanwhile, the opposite system, the parasympathetic nervous system, that's the rest, digest, and eliminate system, doesn't get a chance to engage properly.
So as stress keeps us in fight or flight, the rest and eliminate system is just offline.
Pretty much, or at least severely suppressed. So the intestine doesn't get the signals to move things along naturally.
Which means waste just sits there. It gets harder, drier the longer it stays.
Exactly.
And then, because the natural movement is shut down, we feel the urge, but nothing happens easily. So we have to strain, manually force it.
Right. And that straining puts immense direct physical pressure on those anal veins, which might already be weakened by inflammation from the diet or the metals we talked about.
It's a vicious cycle. The stress paralyzes the gut, leading to hard stool, leading to straining, which directly damages the veins.
And this whole internal environment just spirals. You get more chronic inflammation, maybe weight gain because digestion is so poor. The gut bacteria balance, dysbiosis gets worse. The gut lining becomes more permeable, leaky gut, letting more inflammatory stuff into the bloodstream. The symptoms described in the sources really capture the misery. Feeling like you haven't fully emptied, being aware of a lump or pressure, constant discomfort, and then, worst of all, developing an actual fear around eating because you know what's coming, or fear of using the bathroom itself.
It totally takes over your quality of life, dictates everything. So, okay, before we even think about specific remedies, the sources are really clear. You have to fix the foundations first. Systemic problems need systemic solutions. What are those non-negotiables?
Absolutely non-negotiable. First, sort out the oral health. Deal with cavities, yes, but also plaque buildup, and importantly, consider addressing those old metal fillings with a knowledgeable dentist. Second, get your overall metabolic function checked. Blood sugar, inflammation markers, liver function, get the big picture. Third, the diet has to change. More whole foods, plants, fiber, water, drastically less processed food, sugar, refined flour.
Makes sense. And movement. The sources mention exercise, but they highlighted one type in particular.
Yes, physical activity is crucial to combat being sedentary, but they specifically emphasize strength training.
Not just cardio.
Cardio is good too, but strength training seems particularly helpful here. It helps regulate intra-abdominal pressure, improves core strength, which supports elimination, and boosts overall circulation. Remember, we're asking those veins way down there to pump blood back up against gravity. Better circulation helps everything.
That does make a lot of sense.
Yeah.
Okay, foundations first. Now let's talk about the bathroom itself. There was some really practical, actionable advice stuff anyone can do right away. Kind of an aha moment.
Absolutely. Simple but powerful. Rule number 1, don't camp out on the toilet.
Guilty as charged sometimes.
Right.
Phone, book.
We all do it, but avoid sitting there for long stretches, especially if you're straining or just waiting. The longer you sit in that position, the more pressure builds up in those veins, and blood tends to pool there. Get in, do your business, get out.
Okay. Less time on the throne. What about the cleanup process, hygiene?
Use soft paper, definitely. But the crucial direction is wipe backward, away from the front, especially for women. But it's good practice for everyone to avoid spreading bacteria or irritation. But the gold standard, really, if you have access to it, is using water, a bidet, or even a handheld sprayer or peri bottle.
Why water?
Less friction. Wiping, even gently, can be irritating over time. Water cleans more thoroughly and with much less physical irritation. It helps break that cycle of itching, scratching, and inflammation.
Right, those are changes anyone can start thinking about. So we've done the foundational work, mouth, diet, stress, exercise, bathroom habits. But sometimes, even when you're doing everything right, the symptoms might linger, right? That protrusion, discomfort, maybe bleeding.
Yep.
That's where these two specific natural tools come in, according to the sources.
Exactly. These are suggested for when the groundwork is laid, but you need some extra support for the symptoms themselves. The first one is an oral supplement, usually taken as a capsule. It's derived from horse chestnut. The tree is Aesculus hippocastanum, or Castaño de Indias. It's originally from the Balkans, but grown widely now.
And just a quick safety note I want to echo from the sources. The actual nuts, the conkers, look a bit like edible chestnuts, but they are not edible. They can be toxic raw.
Oh.
Wait, we're talking about a specific extract here, right?
Absolutely. A standardized extract prepared for safe internal use. Its main benefits are being analgesic, so pain-relieving and anti-inflammatory. But its key action in this context is as a venotonic. That means it helps tone and strengthen the walls of the veins, specifically the inner lining, the endothelium. It seems particularly effective for the veins in the lower part of the intestine and the anal area. By making those vein walls stronger and less permeable, it helps them withstand pressure better.
Okay, so it's working from the inside out to shore up the structure of those vessels. Makes sense. And the second tool, that one's topical.
Yes, for more direct external relief. That's witch hazel, Hamomelis virginiana. It's a shrub native to North America. You usually find it as an ingredient in creams, ointments, or often on soothing pads or wipes.
And what does witch hazel do right there on the spot?
It has two main properties that are really helpful. First, it's an astringent. That means it helps to gently tighten and tone tissues so it can reduce swelling and that feeling of protrusion. Second, it's hemostatic, which means it helps to stop minor bleeding, which can often happen with irritated hemorrhoids. So it strengthens those superficial vessels and can often provide pretty immediate soothing relief. You can usually apply it several times a day during a flare-up.
That sounds really useful for managing the immediate discomfort. However, and this is a big however, the sources were extremely insistent about professional guidance for both of these.
Critically important, yes. We're not talking about just grabbing any bottle off the shelf. With extracts like horse chestnut, the dosage matters, the quality and standardization of the extract matter. With witch hazel, you want to ensure it's a formulation suitable for the sensitive area without other irritants. And most importantly, interactions. If you're already using other prescribed creams, especially steroid creams, or taking other medications internally, you absolutely need to discuss using these herbal remedies with a healthcare professional.
Someone who actually knows about these specific natural tools and can advise safely.
Exactly. A doctor, a naturopath, a clinical herbalist, someone qualified and up-to-date who understands potential interactions and contraindications. Please, don't just self-prescribe based on this discussion. Get professional advice.
Okay, absolutely crucial point. So, wrapping this all up, what's the big picture here? What does this all mean for someone dealing with this?
The main takeaway is that hemorrhoids are almost never just a local problem. They're usually the endpoint, the symptom of a much larger systemic imbalance. It could be starting all the way up in your mouth with hidden dental issues sending inflammatory signals. It could be driven by poor digestion because of diet and low stomach acid. Or it could be heavily influenced by chronic stress paralyzing your gut via the nervous system. Often it's a combination of these things.
So relief isn't just about a cream, is it? It requires looking at the whole system.
It requires comprehensive action, a full circle approach, improving oral health, changing the diet, managing stress, moving your body, refining bathroom habits. Then, maybe using targeted natural support like horse chestnut or witch hazel, but under guidance, you have to address the roots.
Right, and connecting this back to the bigger picture, the sources hinted that this kind of chronic inflammation and gut disruption doesn't just stay in the gut. It affects everything, even moods, brain function. That feeling of anguish often goes hand in hand.
It really does underscore how interconnected everything is. So maybe the provocative thought to leave you with is this. If your nervous system is still reacting to everyday life, your commute, your work deadlines, family stress, as if you were literally running from that lion we talked about, what other subtle, unseen, maybe even paralyzing effects is that having on other sensitive systems in your body beyond just your digestion, something to definitely consider as you work on strengthening those foundations.